otherwise known as presbyopia. Now, presbyopia is the technical term, and probably a lot of you have experienced it, but maybe don't know what the word is. In fact, we're going to start seeing a lot more about blurry near vision in the months to come. And this is a picture of me. I'll say this is a staged picture of blurry near vision. I was a lot younger back then, but I have my reading glasses going on here. You can tell this is the original iPad in this ad when Duke won its 4th national championship. They've had 5 since then. But it was just kind of a fun picture that I took that shows that as we celebrate more birthdays, our ability to see up close gets more difficult. Typically in our early to mid 40s, we start finding that we have to hold things a little further, our arms get too short, and that's called presbyopia. And if you look, there's a website that actually recently went up called blurrynearvision.com. It's one that's put on by a company called Allergan, who actually makes Botox. They also make Juvederm, other fillers, and other cosmetic and aesthetic devices. But they're doing an eye drop to help that. That's going to probably be FDA approved later this year. So I've been working with them as a company and helping them as a consultant. So that's something that I think it's helpful for us, all patients, to understand what's going on as we're turning to our 40s. So what is going on? So can I move to the next slide here? Thank you. So basically, blurry near vision, we know mostly as, I have to wear either reading glasses or bifocals or trifocals or something to help with the up close vision. And basically what's happening is the lens inside of the eye. So again, the eye works like a camera. You have the window in the front called the cornea. There's a lens in here to focus everything on your retina. But the lens inside of the eye doesn't focus like it needs to. And as we get into our 40s, it becomes stiffer and it becomes dysfunctional. And as we get into our generally 50s and 60s, it becomes and even beyond, becomes cataract. So here's what's called a slit lamp view of the eye. You can see the haziness inside the eye here. Schematically, you see that the lens in there has gotten foggy. And because of that, when the light comes in, instead of focusing sharply, it actually scatters and causes glare, causes halos, and causes problems with the vision at nighttime. And just as a simulation, this is what good vision is. So if you look at, this is actually a picture of my daughter's from a few years ago, and a cataract, it loses the color, it becomes blurrier, there's more side effect from other lights, a lot of decrease in not just the quality, but also the clarity of the vision. So that's something that happens as our lens progresses. So it goes from clear and flexible, where you can see distance and up close. You can do LASIK if your focus is off, but the problem is, and we'll talk about LASIK tomorrow, is if that lens doesn't do its job, it doesn't do the zooming from distance and up close, once it gets hazy, simply doing laser on the cornea, which is what LASIK is not going to be enough. So then we have to talk about doing some lens surgery. So we'll move on to the next slide here. And so this is an example of what it looks like after we have lens surgery. So schematically, that lens in there, instead of being hazy like it was before, is basically removed and the lens implant put in its place. The surgery itself is generally pretty quick and painless, and the vision recovers quite quickly. So that's what a cataract looks like, and a lens and replacement lens looks like that. So compared to the left side there, where it's nice and clear, and the hazy cataract on the right side. So what happens if you think you have a cataract or you're having trouble with blurry near vision or presbyopia? Well, you come in for a cataract, or we call it a refractive evaluation. So both Dr. Gao and myself sees patients, but you'll come in, we'll do some extensive testing, both with you reading eye charts and also taking pictures of the eye. And that gives us some good information about what's going on in your eye. And then you get to meet us. So there's Dr. Gao on the, I'm not sure about left and rights here on the projection. There's Doctor, I think he's on the right, I'm on the left there. But that's the screen that I see. And you see, basically you'll come in, you have a conversation. Either one of us will do an exam for you. And then we'll also talk to you about what your options are from a surgery standpoint. The evaluation generally can basically let you know what's going on. And then the big part of it is deciding what you want to do. So assuming that you have a lens that you want to remove, either it's dysfunctional or it's hazy with cataracts, generally people get, well, everyone gets at least a basic IOL or intraocular lens implant. So that, what it does is it does some of the focusing, because again, there's a lens in the eye that we're removing. We have to put a lens back there to allow you to be able to focus again. And a lot of times afterwards, you may know folks who have had lens or cataract surgery, they end up with a pair of glasses. And the glasses are frequently the bifocals. You have a correction up top, a different one on the bottom. That could be a trifocal or a progressive, but that basically gives you that difference so that when you're reading, you can see down below and you can see up top. The nice thing about the bifocals is it has basically multiple glasses in one. There's a number of drawbacks, include some people who don't get used to them. They get headaches. You have to tilt your head to try to see things. But even more importantly is it does lead to tripping and falling. So in fact, studies have shown that especially as we get older and we lose our ability from a balance and stability standpoint, is the bifocal glasses more than doubles the risk of tripping and falling. In fact, 1 in 3 falls in elderly Americans is related to their bifocal glasses. So if we're doing lens surgery, and this is where we get into the lens implants, is we have an option to build in that range correction or to correct that presbyopia with the lens implant. So without getting into too many details about different lens implants, because it can get confusing, is that when I take your lens out, when Dr. Gao takes your lens out, we replace it with an implant that not only can restore focus for distance, but it can restore it for many different ranges, including up close. So a lot of patients who are wearing glasses or bifocals or trifocals or progressives are not wearing glasses at all. Now, it's hard to say that we'll be able to get everybody out of glasses, but the goal is, if you want to reduce your need for them to as little as possible. So we have basically on the slide here, the Tecnis one-piece lens. All the lenses I use are made by Johnson & Johnson. They're the best quality lenses on the market. I went to Caltech, a little bit of a science nerd there, so and I actually work with Johnson & Johnson in developing some of these lenses. The Tecnis Eyhance, or the Toric 2 version of that lens, corrects astigmatism, and it provides a little bit of a range, mostly fixes astigmatism. We're currently actually in a FDA study, or in a clinical study, that's looking at the Tecnis Eyhance, which is trying to figure out exactly how well it functions for certain situations. The Tecnis Symphony, this lens, is one that provides a nice functional range of vision. It also fixes astigmatism if need be. But for the really small print up close, you might still need a little bit of reading glasses. And then we have the Tecnis Synergy lens, which provides a really full range of vision, so it allows you to see the up close things without reading glasses, but it can cause some starbursts and halos around lights at night. So there's always a trade-off, and the only way to know what's best for you is to come in for an evaluation. So you come in, we do the evaluation, we take a look and say, hey, this is what's going on, these are what your options are, and this is how it's going to affect your life moving forward. So again, with all these lenses, they're basically advanced lenses that can treat the presbyopia and reduce your need for glasses. Now, it's fun to say that we've actually been one of the original investigators for the Tecnis Symphony and the Tecnis Synergy lens. In fact, I was one of the first 1 or 2 surgeons to implant these in the eye here in the US and in the world. The Tecnis Toric 2 and the Eyhance lens, we're currently, like I said, doing some studies. So again, we're very familiar with this technology and how it worked for you. We've done thousands of patients altogether between Dr. Gao and myself. And certainly, if you're having trouble with your vision, you're having trouble with your near vision, we do have some great options for you. Now, after we decide that, actually, you'll meet with our surgical counselor. We'll figure out a date, go through the logistics, and then we do surgery. It's an outpatient procedure. Generally takes about 10 or 15 minutes. There is an anesthesiologist there, so you'll be nice and comfortable. Most people don't remember much of surgery at all. Every now and then, I'll have people fixating on some lights, but definitely no pain there. I separately numb up the eye, so we have a kind of double layer coverage. And most people kind of remember when they wake up in post-op, or some people wake up at home. At least that's what they remember. But the key part is it's going to be a very simple and pleasant experience. Like I said, from a vision standpoint, most people recover that pretty quickly. Generally, by the next day, people are seeing, or within a few days, are seeing some improvements. But it can take a few weeks to stabilize. So I never do both eyes on the same day. Generally, I do them about 2 weeks apart. So I would do, whichever eye makes sense first, and then make sure it's doing well. My colleagues or myself would see you afterwards and make sure it's giving you the vision that you expect. And assuming that it is, then we'll move on to do the other eye in a couple weeks. And if you kind of like certain aspects, but you wish you had more of another aspects, that's why we have the many different types of lenses we can choose from. So that allows us to customize or personalize each approach to each one of your eyes as we go along. So we make a decision of a treatment plan. We do one eye, see how it does, and we can adjust the treatment plan if needed for the second eye. So the final goal of surgery, obviously, is a happy patient. So by taking out your lens that's dysfunctional, that's not working, that's causing blurred near vision or blurred vision altogether, otherwise known as a cataract, putting in one of these lens implants can restore that vision and actually give you better functionality than even before you develop a cataract. So I have a lot of patients in their 60s, 70s, and 80s who say, I haven't seen this good since I was a kid. In fact, I never saw this good without glasses. So it's fun to be able to do that. And we'll talk about LASIK tomorrow, which is great for my younger patients, 20s, 30s, and 40s. But there's things I can do in your 40s, 50s, and 60s and beyond with lens implants that I can't even do with a laser. And most people don't realize that. But the bottom line is when you come in for an evaluation, either a refractive consult or a cataract consult, we look at you as an individual. We look at your your age, your prescription, your eyes, your medical conditions, the whole picture, what your career is, what kind of hobbies you have, to give you the vision that will function best for you in the activities that you need. And at the end of the day, people say, hey, well, what would you do with your mom? Well, this is what I did for my mom. So a few years ago when she had cataracts, I ended up doing cataract surgery for her. At the time, we had the Technis Symphony lens. That was the state-of-the-art lens, and that's what I did for her, which is the one that gives a range. It's still my go-to lens right now. Like I said, we have some other lenses that do a little more of this, a little less of that, but I did put 2 Technis Symphonies in her, and she's doing quite well. A couple years later, people say, hey, you did your mom, but what about your mother-in-law? Which takes it up another level. So I did do surgery on my mother-in-law as well. In 2019, she also got 2 Technis Symphonies, and she's quite happy with those. So again, hopefully that was helpful and informative. As we get into our 40s and beyond, the lens starts to become dysfunctional, becomes a cataract. And the good news is it's a quite simple solution. Cataract surgery and what we'll talk about tomorrow, laser eye surgery with LASIK and PRK, are some of the most successful surgeries in the history of medical procedures. However, they are definitely surgeries, and there's definitely many considerations or some risks. So that's something that we'll talk to you about when you come in. So
we do have a question. How long will this last? I'm in my late 50s.
So that's a great question, is how long does lens surgery last? And we'll talk about that for LASIK tomorrow as well. But lens surgery lasts, if you're late 50s, I'll say 40-something years. I usually kind of somewhat joke, so they'll take you to 100. Basically, these will last indefinitely. These lens implants, this material has been around since the 90s. It's been inside of human eyes, and I've seen no degradation or change, at least with the J&J polymers. Very good quality lenses. And the idea is you were born with your lens. It aged through your childhood, teens, 20s, 30s, 40s, into your 50s, and now you're getting the symptoms. So once I remove that lens, that's a one-time permanent surgery, and the implant you get stays in there. So the nice thing is when I correct the vision, the expectation is that's going to be permanent for the rest of your life. Now, sometimes other things happen to the eyes. It can change. We could go back and fine tune it. But in general, once I do lens surgery, I expect after it settles within a few weeks, that's going to be stable indefinitely.
So what is if you could just talk about the lens selection criteria one more time, just the highlights of that.
So it can get kind of complicated in terms of the criteria for lens selection. Generally, I kind of talk about the lens to let you know the general idea of what we're doing. But when I see you as a patient, I look at what you're doing. We take a little question, like I said, to see what your occupation was or is, what your hobbies are. And I say, hey, this is the lens or the combination of lenses that'll give you the functionality that you want. Because I find that patients think about functionality. Do I need glasses for distance? Do I need glasses for reading? Do I need glasses at all? And in terms of the names and the types of lenses and astigmatism, it gets all confusing. The bottom line is we have actually a fuller range and complement of lenses that we can use to treat more or to create more different visual abilities than we've ever had before. So if you have astigmatism, you don't have astigmatism, we can address both of those. If you want to see really sharp in the distance and don't care if you wear reading glasses, we can do that. If you want to wear glasses as little as possible for distance and up close, we can do that as well. So there's a lot of different options we have. And ultimately, each patient has their own preference. And based on the health and other issues going on with their eyes and health, we have a slate of options for you. So it's not something that I expect a patient to come in and say, hey, I want this lens and this and this. But you do want to think about, hey, these are the activities I do, and I want to be able to function this way. I want to not wear glasses. I want to be able to see well. And then I can basically match what you would like with what we have.
Okay. That's all the questions we have.
Okay, good. Well, thanks for listening. And again, welcome to our 12th annual MAB. It'll be a great week. We'll have discussions about laser eye surgery tomorrow and aesthetics treatment as the days go on. We'll have the live event later in the week. But I think we have a winner announcement, I suppose, coming here soon. So we'll let Alex take care of that.
All right. I'm going to take over here. Thank you so much, Dr. Chang. A wonderful presentation, very informative. So I'm going to go ahead and pull up our little winner wheel here. And let's see. Oh, close one. Jay Horton, you are the winner of a $400 Empire gift card. Congratulations. Please go ahead and DM us or send me an email, info@empireeyenlaser.com. And congratulations. We'll get that up to you. So again, as usual, if you have any other questions, if you want to learn more about vision correcting through lens implants, definitely go ahead and give us a call, set up a consultation with Dr. Chang or Dr. Gao. Usually one of our optometrists will talk to you first and check you out, and we'll go from there. So we're, again, excited to have MAP going on now. Make sure you go to empireeyeandlasercenter.com/events and check out all of the specials we have going on, and you'll also see all of the amazing sit and sip sessions we have coming up today, tomorrow, and Wednesday. Thanks again for joining us, and have a great, amazing rest of your day.